Dr. Alagarsamy sir, and welcome all the students who are present here and who have joined online for this online lecture on evidence-based Panchakarma. And today's topic is very unique, like clinical application of NASAPANA. And of course, Dr. Alagarsamy sir will give his valuable inputs or his clinical experience. He will share his clinical experience on the NASAPANA. So on behalf of Department of Panchakarma, I welcome you all in this session. And for the formal introduction of Alagarsamy sir, I request Dr. Rishanki to introduce sir. Over to you, Rishanki.
Thank you, ma'am. Good afternoon, everyone, and a welcome to our distinguished speaker, Dr. Alagarsamy sir. It is my pleasure to introduce Dr. Alagarsamy sir, who will be gracing us with their presence today. Dr. Alagarsamy sir serves as the Managing Director and Chief Physician of Alagumalayan Ayurvedic Hospital, situated in the scenic Alagakoval near Madurai, Tamil Nadu. A recipient of the Distinguished Alumni Award from the Ayurveda College in Coimbatore, he has demonstrated unwavering dedication to the field of Ayurveda. With a profound interest in Ayurvedic herbs and medicinal formulation, Dr. Alagarsamy actively contributes to the academic and professional growth of future Ayurveda practitioners. Sir also engaged various activities for the students like tracking expeditions to identify medicinal herbs, preparation of rare herbal mineral formulations, and in-depth clinical case discussion at his hospital. Dr. Alagarsamy, insatiable curiosity and drive to continually expand his knowledge have established him as a revered specialist Ayurveda practitioner. Patients from diverse regions of the country seek his expertise, drawn by his reputation for effectively addressing challenging medical conditions. Renowned for his willingness to share clinical insights, Dr. Alagarsamy excels managing critical cases such as acute appendicitis and acute tonsillitis, even when these conditions are initially slated for surgical. Even furthermore, he has developed a notable record in treating musculoskeletal and neurological disorders, which are among his area of expertise. His exceptional clinical acumen and dedication to patient care have earned him widespread admiration and trust. We are deeply honored to have you, sir, for joining us for the imminent topic of like a NASA PAN. It's a very rare topic the many people didn't discuss about and having a clinical experience for so that. So we have deeply honored for that, sir, in the series of evidence-based Panchakarma. Thank you, sir.
Introduction of NASAPANA can be understood as a modifications of the Nasyakarma, administrations of the large quantity of medicines through NASA marka, mainly used in the Vadayadi, specifically Urtva Jatrgada Vyadi. A reference can be found in Shakradatta, Pava Pragasa, Vangasena, and Faisija Ratnavali. Next. Advantages of the NASAPANA over Nasya: larger dose, more contact times, nasal and GA absorption, Sodhana and Samana in action. NASAPANA ingredients: Palamula, Erandamula, Aswagandha, Kabikachu, Masa, Rasana, each 6 grams, crushed well and add 300 ml of the water, boiled and reduce it to 75 ml. Palamula, Sida cardifolia, Malvaceae family, Erandamula, Ricinus communis, Euperpiaceae family, Aswagandha, Vidania somnifera, Solanaceae family, Kabikachu, Muguna prudens, Babesia Regnaceae family, Masa, Pesiola Mungo, Rasna, Alpinia Kalanga, Gingibraceae family, all are crushed well and 300 ml of the water boiled and reduced it to 275 ml. This is enough for common NASAPANA. But if a patient is Kava Pradhana, add 1 gram of Gundi and 1 pinch of Saindava Lavana. If a patient is Pitta Pradhana or Buddha as required. Next. Patient lie down in the supine position. Purva Karma Seyana Sevadana can be done if required, not necessary. Slowly administer the prepared medicine in the both nostrils. Ask the patient to drink the medicine. Once the medicine reach the throat, ask them to spit it out. Do the medication till the comfort of the patient. If the patient resists, stop the giving medicine. You can repeat the procedures 3-7-5 days as per the palam of the patient. Procedures. Sputum expelled out after the NASAPANA. The NASAPANA are the excellent stress reliever. NASAPANA gives good sleep, stimulate the functions of the sense organ. Breathlessness due to the nasal block is cured by the NASAPANAs. Good for DNS, the deviated nasal septum, relieves the unknown causes of the headache. My student, Dr. Anand Kannur from Kerala, told me that hypertension was reduced, completely cured by NASAPANA followed by the Bringanachya, like Dhanvandram 101, one patient. He told me the heaviness of the head, better result by NASAPANA. Some patients have the morning giddiness. In these conditions, NASAPANA completely cured the giddiness. Brain functions are activated by the NASAPANA. Sinusitis. NASAPANA action in sinusitis. Very excellent result by NASAPANA in sinusitis. Sinusitis, the NASAPANA only enough. Don't give Bringanasia in the NASAPANA. After NASAPANA, Jeeragam 2 parts, 1 part Sundi crushed well and add 1 liter of water boiled and take a drinking water in the sinusitis condition. In the bedtime, Haridagi Churnam, 1 teaspoon. Very excellent result for the sinusitis. Also, followed by NASAPANA, Pajana Tibana Vadanu Lomana in the sinusitis is very effective medicine, no recurrence. Next. Wait. Indications of the NASAPANA. Kabacha Sirasulam, Pradishayam, NSITs, CVA, Pakshagadam, Ardidam, cervical stenosis, neck pain, cervical radiculopathy, Swasa, Kasa, Anitra, morning giddiness. Contraindications of the NASAPANA, Hikka, Kshadam, Udararokam, Murcha, Pala, Garpani, lactating mother, Mandakni, the unconscious and semi-conscious patient to avoid aspirations and death. One clinical case I have successfully treated by NASAPANA. The patient age 60 years male, he difficult to stand and unable to walk. And he was also treated many allopathic hospital and 3 Ayurvedic hospitals for several months. In Ayurvedic hospital 5 months, but no improvement in his conditions. By in our hospitals, the patient has treated successfully 3 sitting. Next. Cervical stenosis, MRI report, dorsal spine MRI, cervical stenosis. Wait. Before C3 to C4, 3.5 mm, C4 to C5, 5.5 mm, C5 to C6, 4.8 mm. Before treatment, the MRI scan. Next. Impression, cervical stenosis, foraminal disc protrusion gene at level, C3, C5, C6 and C6, C7 level. Treatment given, Uttvartanam, Abhyangam, Matravasti, Kasayavasti, NASAPANam and Bringananesium like Danvandara 101, Prasanyadi 101, Chirabala 101, anyone, and Girda Banam for 10 days. Patient already have lot of allopathic and Ayurvedic medicine, so I limit the internal medicine. Some same treatment was repeated twice in the interval of the 2 months for the 10 days. NASAPANA is a southern Asian. NASAPANA followed by Bringananesia should be given other Danvandara 101. NASAPANA is excellent and sinusitis, cervical stenosis and neck related issues. After treatment, C3, C4, 7 mm increased. The diameter of the cervical canal is increased 7 mm. C4, C5, wait. C4, C5, 6 mm. C5, C6, 7 mm. After treatment, The cervical canal is dilated. Before, this is before. After treatment, patient was able to stand, able to walk. He was claimed the cobra of the temple. The video is given. He is a architecture patient. Case 2, the patient, 52 years male patient, he was working PWD divisional engineer. Sudden onset, unable to stand and walk suddenly. Both limbs are affected. Both limbs not working. Patient not a known case of diabetes mellitus, hypertension, cardiovascular disease, pharyngeal asthma. Patient was discharged from Alagumalayan Hospital. The CT brain is normal, but Coril AIDP, acute inflammatory demyelination polyneuropathy, AIDP, chronic CIDP also there, chronic inflammatory demyelination polyneuropathy. AIDP is a like GPS, Guillain-Barré syndromes. Guillain-Barré syndromes affected from lower limb to upper gradually, but AIDP is suddenly onset affected, the both limbs, four limbs affected. In allopathic hospital, he was given heavy steroids in ICU for 1 month, but no significant improvement. Doctor told that 100% no chance to walking in future. Next. Treatment given Udduvartana for 3 days, Abhyangam with Kili, Matravasti and Kasayavasti for 7 days. Internal medicines, Suryaksharam 1 TID, Brigat Vadasindhamani Ras BID 1 BID. Suryakshara is my own preparation. Suryakshara is mentioned Rasa Tarangini, Rasa Sala, Suddhi, Paishitya Ratnavali, sorry, Rasaratna Samsayas are told in the Suryakshara. Suryakshara has 15 synonyms. Suryakshara action is Krodha Moha Visodhanam and Krityam and Rasayanam. In Tamil, Vediyuppu, this is excellent medicine for all type of Krodha Roga disease. In this concept, the Suryakshara is I was given to the patient Suryakshara, Krodha Moha Visodhanam, the concept. The Brigat Vadasindhamani, then Asugandha Kritam 2 teaspoons with hot water. This is the main medicine. Next. After 20 days, the patient was able to next before forward backward before after 7 days the patient is able to stand and walk by holding the wall. During the treatment, the patient was discharged with discharge medicines, Suryakshara 1 TID, Brigat Vadasindhamani Ras 1 BID, and Asuvanda Krudam 2 teaspoons with hot water. Next. After 20 days, patient was able to walk and stand without any support, but the handwriting did not improve. This is the first case for my NASAPANA treatment. Before, I didn't done any NASAPANA for any patient. Then the NASAPANA was done for 3 days and followed by Bringananasia Dhanvandra 101. 4 drops each nostril was given for 2 weeks. The patient was completely cured from AIDP. The patient has been living since 7 years without any complaints. Conclusion: the extended versions of the Nasia, large quantity of the medicines they injected through the NASA marka, specially practiced in Urtva Chaturgadhara, Vadaja and Vada Kavaja, but both Sodhana and Samana actions can be achieved through the NASAPANA. One more, thank you. One more information in the emergency treatment. One more information. The emergency treatment in the Pallada Sorasas, 2 drops as a Nasya in the each nostrils and 2 drops as a eye drops. Immediate result for any emergency conditions, patient unconscious or semi-conscious or febrile disorder, anything. The same Sorasas was seizures, febrile seizure disorder, very effective medicines. In the COVID-19 lab, I had treated many patients through Nasya and Tarpana with Palandu Sorasas. Immediately, saturation level is increased after applications of the Palandu Sorasa, Asya Nasyam and Tarpanam. Okay, thank you.
Thank you, sir. Thank you for such a wonderful presentation. And first, the question, I think Dr. Harini is having some questions. She has raised the hand. Dr. Harini, you can unmute and ask that question directly to sir.
Okay. Namaste, Dr. Alagarsamy. I just wanted to ask, okay, what is the other uses of Suryaksharam in your practice? You told it has multi utility.
Suryakshara is used for many purposes in our clinic. First, Suryakshara is purified with rainwater or sea water. The 1 kilo of Suryakshara added with 4 liters of water and boiled and reduced till the paha. The paha point a stick is inserted in the medicines and the stick is put on the nail beds. Or small drop is there and the drop immediately freeze like a yellowish coloration like dal. Thoram Barup Mari or other, that is a paha. Then the medicine is kept a 1 day for a place. Next days the crystal form is formed inside the bot. The crystal form is collected. Then again 4 times of the water to the medicine, sea water or rainwater, again boiled. The same procedure is done for 3 days or 3 times. This amount of the medicine, half kg of the Suryakshara mixed with half kg of Sutti Gandhaka, mixed very well and fire it. All is burnt the inside the pot is the ash is deposited, the acid is collected, then grind the nice powder. The powder is filled in the capsule, 50 milligram per capsule, 2 capsule may be given to the patient. One time or 1 gram கொடுக்கலாம் ஒரு பேஷண்ட்டுக்கு. There are lot of indications, coronary artery disease, cholelithiasis, fatty liver, triglycerides, thyroid, weight loss, renal calculi, stone, renal calculi, எல்லாத்துக்கும் the same medicines used in our clinic. If the stone is ureter, 2 or 3 days is enough. If the stone is lower lobe of the kidney, 10 days is enough. If the stone is middle lobe of the kidney, 15 to 20 days for medicines. Upper lobe stone is 1 month is needed for the medicines.
Sir, where we will get this Suryakshara?
I think you have to prepare.
Yeah, but what is the
The need, raw material.
Raw material from
where will you get?
Hundred shop is available. All the hundred market, நாட்டு மருந்து கடையில available.
which market?
He means raw drug stores, na, where you get this.
வெடிப்பு அல்லது சூரியக்ஷாரா, potassium nitrate, KNO3.
Potassium nitrate.
Available the chemicals or all country shop of.
Yes,
Herbal.
yes,
Yes.
yes, yes, sir. Anybody else having any question? Yeah, I think there in chat box there are 2 questions. Can you repeat what said in the last about NASAPANA in emergency? Dr. Tingu has asked that. Last about NASAPANA in emergency, you told, sir. She just want to repeat that, or the doctor want to repeat that.
Emergency, any conditions, if the patient conscious or semi-conscious, or febrile seizure disorder or febrile disorders, any kinds of unconscious, and the Palandu Sorasas, Palandu Allium Siva Liliaceae family, Palandu Sorasas are used as a nasal drops, 2 drops each nostrils, and used as a eye drops, 2 drops in the each eyes. Immediately patient get out from the unconscious. I have treated lot of patients in our clinic.
So for the coma patient also we can give this, sir?
Yes. Now not coma patient. If large blood clot or the brain or cardiac arrest is very heavy or more not recovered, but small unconscious is immediately relieved.
Okay, it's like syncope.
Oh, yes, like syncope. We can try all type of unconscious patient. Palandu Sorasas.
So what is the dose of that Swarasa, sir?
2 drops each nostrils and each eyes.
Which Palandu?
Might be use 4 drops or 6 drops as per conditions.
Sir, there are some unni, there's a small Palandu, bigger Palandu, white Palandu, red Palandu. Which Palandu you are telling, sir?
Ulli, Chinnolli in Malayalam. Chinnolli, Allium Siva Liliaceae family. Chinna Vengayam.
Okay, that
Not
is not
Ballari.
a north part of
Not
India.
Ballari. Not Ballari, not white Vengayam. White onion.
Okay, that small one.
So what about the duration of treatment for the NASAPANA? Is according to the different diseases, how much days we are prescribing in different conditions to the NASAPAN, then it is followed by the, you said earlier that in the both the cases, the NASAPAN is followed by the Brahan. So in the first case, the duration is different, and other case duration is different. So it's very much clear that it is very specific to the disease. And so how, on which factor we can decide that what would be the duration of the Nasapanam and what would the duration for the Brahanasya in those specific disease conditions? Can you please guide us, sir?
In Kapha predominant disease, NASAPANA is very effective, followed by Brahmanasya, Vada Kapha or Pitta, Vada Pitta Kapha, Brahmanasya is necessary.
Either they are asking for how many days
3 days.
Nasapana and how
NASAPANA,
many days
NASAPANA,
Brahmanasya.
NASAPANA is done for as per the balam of the patient, 3 days, 5 days, 7 days. Balam of the
And so,
patient. Yes, yes.
and so the duration of the Brahmanasya is also different for both the cases you are presenting. In the second case, you give the Brahmanasya for 2 weeks. And in the first case, the duration of Brahmanasya is different. So we decide according to both the disease condition and according to the bala of the patient. And the minimum dosage of the NASAPANA is 3 days, or maximum is to 7 days, just like the SNAPANA, sir.
Only 3 days, 7 days for NASAPANA, but Burgananitya, as per record of the patient, we can done for several months or several weeks, such as.
But sir, it also varies according to the disease condition. Now, so can you please tell us in which disease conditions we can put the longer duration and in certain in which disease condition the duration must be the smaller.
Vada disease, we can done for several months. I can't understand what your question.
The question is எவ்வளோ நாளைக்கு டிபெண்டிங் ஆன் என்ன கண்டிஷனை பேஸ் பண்ணி பேஸ்ட் ஆன் வாட் கண்டிஷன் நீங்க வந்துட்டு யூ ஆர் டிசைடிங் த நம்பர் ஆஃப் டேஸ் ஆஃப் பிரம்மண நசியான்னு கேக்குறாங்க. எவ்வளவு நாளைக்கு ஒரு சில கண்டிஷன்ல சீக்கிரமா கொடுத்துடுறீங்க, ஒரு சில கண்டிஷன் யூ ஹவ் கண்டினியூட் ஃபார் 2 weeks or 3 weeks எல்லாம் கொடுக்குறீங்க. ஸோ வாட் இஸ் த
4 drops each dose is minimum dose.
பேஸ்ட் ஆன் வாட் ஃபேக்டர் என்ன பேஸ் பண்ணி
Patients not a complaint of heaviness of the head or running nose or fever or indigestion, அதை ஃபாலோ பண்ணி we can try it. We can try based on the Agni patients today complaint. No any complaints to the Burgananasya. The Nasya continues for several weeks or several months. Any complaints stop some several days and again continue.
Okay, thank you, sir.
I think there are no any more questions. It was very clear presentation, very easy to understand presentation, but very deep presentation. Thank you so much, sir. You have presented such a good clinical data and
Thanks,
with
madam.
your experiences. On behalf of Department of Panchakarma, Faculty of Ayurveda, BHU, I really thank you, sir.
Thanks,
From my
madam.
heart. And our all students are so happy to listen you on this unique concept of NASAPANA, which we were not using in our daily practice. So hereafter, surely we will use, sir. Thank you so much. And Divas Sethi has raised the hand. You can unmute and ask the question. Divas Sethi.
Yes. Namaste, sir. Sir, actually, my question is like there's a procedure of NASAPAN, like you explained in the video, sir. It was given with saving in drop wise. Sir. So that continuity of dropper, like, should it be like stopped in between, like when we do Nasya in the same way, or like the procedure is like same as Nasya, sir? And the dose you told us 75 ml like in the insulin.
I can't understand the questions.
ஓகே அழகர் அவங்க கேக்குறது டிராப் நாசாபானம்னு சொல்லிட்டு நம்ம வந்து நசியம் மாதிரி we are giving it as a drops மாதிரி தானே போடுறோம் அப்படின்னு கேக்குறாரு. டிராப்ஸ் மாதிரி போட்டா கரெக்டான்னு கேக்குறாரு ஒண்ணு. டிராப்பா விட்டா போருமான்னு கேக்குறாரு ஒண்ணு. The second question is 75 ml நீங்க சொன்னீங்க நாசாபானத்தோட டோசேஜ். Is it for both the nostrils or single nostril க்கு 75 ml ஆன்னு கேக்குறாரு. இது ரெண்டு கொஸ்டின்.
Two traps, then increased it 4 traps, then 6, 10 traps. Consequent of the increase பண்ணிட்டே போன trap. Patient is difficulty, drop is மறுபடியும் reduced. In between one trap to another trap, some cap is there. Patient comforts, then again we will try it. 75 ml total we can't give the patient because 2 or 3 times or 3 the patient is very tired, some patient. If it is patient tired, we will stop the medicine. As per the comfort of the patient, we will increase the 5 times, 3 times in between cap. The NASAPANA is given.
So that Avichinna Dhara should be continued. It should not be drop.
Yes.
No, doctor, I think it's drop only. So
Drop only.
yeah. So first you give 2 drops in the each nostrils and then increase to 4 drops, then increase to 6 drops in each. You alternate it on each nostril. And once the patient is comfortable, you can continue the same gradually up to 10 drops in each nostril, alternating in each nostril. After that, if the patient has any discomfort, you stop it and reduce the dosage. Reduce the drop frequency. That's what he means. And second thing is
some patient is not disturbed until 20 drops because of the big kabala. After 20 drops, they will split the sputum. Some patient 2 to 3 drops split the sputum.
Yeah, once the patient got the it is there in their throat that they have to split out, then we have to stop. If patient don't have any irritation. Is it so, sir?
Yes, sir. Yes, madam.
Okay. So two drops, then we will wait for a while. Again 4 drops, then again we will wait for a while.
Yes.
In 6 drops, we will wait for a while. Once the patient says yes, that I have come, this medicine has come in the throat, then we will ask him to split out.
NASAPANA is duration completed minimum half an hours. One day NASAPANA finish arat.
Okay, it takes 1/2 an hour.
Yes.
1 day procedure.
Some caps are trap, some cap, again traps, some cap.
Okay. So can we say it is like whenever there is kapha pradhana avastha or the ama avastha in upper part of the body, so we can go for the NASAPANA as a rukshana therapy? Can we say like that?
Amavastha, indigestion, jara, NASAPANA is contraindicated.
Okay, in ama avastha it is contraindicated.
Yes.
Okay, so after doing the proper rukshana only, we have to go for the NASAPANA.
Yes.
But it is tikshna treatment.
Okay. Yes, madam.
Okay. So after that only you have to go for the Bruhana. If I am not ready for the Bruhana, if I do only NASAPANA, can we leave the patient or we have to go for the Bruhanasya?
Yes.
We have to go for the Bruhanasya. Okay. So that means the NASAPANA will increase the Vata. Is it so, sir?
No, increase Vata, increase Pitta.
Okay, it will increase the Pitta. To pacify the Pitta, we have to give the...
Yes, Pitta, we can add Gudam.
Okay.
Yes.
Okay. If anybody have any... So how to taste, sir? Like when we have to add Guda, like after patient tail complaint or irritation, then only we can add the Guda.
Patient sometimes irritation in the nasal tract or the eyes or the ears, up to the throat, irritations, feel some patient complaint irritated, burning sensation may be present inside that. That times we will add the poda. Otherwise, we cannot add the poda. It is not any complaint. Kava pradhana, no irritation, something for add 1 gram of chundi, chainda lavana, 1 pinch.
Okay, sir. I have experience of taking Shunti Nasa. There was one practitioner, medical officer in Sangli, one part of Maharashtra, where we were doing our internship. He used to give the Shunti Vacha Nasya, Shunti Vacha Pana Nasya. And once, like, everybody was going to that, those who are having sinusitis or Jina Pratishaya, they used to take this. Once I went there and just to try that nasya, and I took that nasya there. For 3 days, there was the irritation and burning in my nose and the whole head. So that time I understand, yes, because that was the internship, I understand, yes, it is the sensitive GIT, or you can say it's the Pitta Prakriti. So when you told pinch of Shunti, I was feeling, oh, this is not for the Pitta Pradhana. Of course, it is for the Kapha Pradhana only.
Either Pitta Vata Kapha patients, we can, the minimum dose for first day, then second day, we will increase the dose. Third day, otherwise increase the dose. First, minimum dose.
2
First
drops.
day. Yes, yes.
2 drops. Yes. Anybody else in having question? NASAPANA method can be done same as Nasya, sir. And how much dose, sir, we should give? As you mentioned, 75 ml. It will be 75 ml in both. Okay, it is already you answer, sir. This question. Yeah. So with this, thank you, sir. Thank you so much.
Thanks, man.
Yeah, and thank you all who have joined online. And for next lecture on next Saturday on 31st of May 25, Professor Subin from the Kotak Ayurveda College will deliver his lecture on the therapeutic application of Kerali Upakramas in Panchakarma. So thank you all for joining us, and thank you, sir, once again. Thank you so much.
Thanks, man.
Yeah. Thank you all. Thank you, Harini.
Thank you.
Yeah. Namaste.
Yes.